Great. Well, first of all, good morning to everyone who's joining us, not only to our panelists, men and women who are dedicated to serving veterans, who you'll hear from shortly, and they'll tell you a little bit about the organizations they represent and the things they're working on. But I want to thank everyone for tuning in or zooming in this morning at our Veterans Roundtable. It's a series of events that we do from time to time throughout the course of the year to discuss issues of interest to veterans, talk about some of the challenges and the opportunities to better support veterans and their families, and to provide information. So again, welcome, good morning, and I am Congressman Anthony Brown. Our country makes a sacred promise to our veterans for your immense sacrifices, and we pledge to take care of our veterans and their families when they return home. That value is core, certainly to my work on the House Armed Services Committee, and now as a new member of the House Committee on Veterans Affairs. While veterans may have served in different conflicts in different theaters and at different times, our common creed binds us together: love of country and service to others. It's our responsibility as a country, grateful for the service of veterans, to help veterans reach their full potential and tap into those talents. It's not enough to simply thank veterans for their service. We show our thanks through action, through access to higher education programs that give veterans the knowledge and skills they need to succeed, through job and career opportunities, through safe, affordable, and quality housing for veterans to live and raise their families, and through the best healthcare that this country has to offer to heal the physical and often mental wounds of war. But we have a lot of work to do ahead of us. Last Congress, we passed into law important safeguards for veterans during the COVID-19 pandemic. Some of those safeguards included more money for the VA to serve our veterans during the crisis, safeguards for veterans pursuing college degrees, expedited stimulus checks for veterans and their families, as well as expanded mental health services. And last Congress, we passed into law the most sweeping actions in a generation to foster diversity and inclusion within the armed services. As part of the Veterans Affairs Committee, I'm committed to fostering that same diversity, inclusion, equity, and justice for every veteran. We're prepared to deliver meaningful progress for those who've served. I applaud Chairman Takano, Mark Takano from California, the chairman of the Veterans Affairs Committee. I applaud him for his leadership and clear vision. Over the next several months, he has committed our committee to work in a number of areas, create a more welcoming VA, and build equity for all veterans, no matter their race, gender, sexual orientation, or background. That means improving care for women veterans, modernizing the VA, and improving long-term care options for our veterans. We'll improve services for suicide prevention, because today we still see 17 veterans die by suicide each day, and our work is far from complete until we drive suicides to zero. We'll not only recognize the harmful effects of toxic exposure to veterans, but work with veterans to heal and recover from that exposure. There's no reason that veterans and their survivors should have to fight the VA for the care and benefits that they've earned. We'll also continue to provide rigorous oversight of predatory lenders and other bad actors who target veterans, and ensure that the VA and the federal government is living up to our sacred promise. Serving as part of the best fighting force in the world is one of the greatest honors in American life. And while every service member will eventually take off the uniform, our sense of duty stays with us and continues to ground our lives. So again, it's great to be with you, my fellow veterans, this morning for this important discussion. And with that, why don't we go ahead and start with the introductions. Maybe we can start with, is Michael Heimel with us today?
Hi, Mr. Brown. Mike Heimel. I'm the director here at the Washington, D.C. Veterans Affairs Medical Center. We cover 5 counties in Maryland, the District of Columbia, and Northern Virginia with healthcare support for veterans.
Welcome, and thanks for joining us today. Nikki Barnes.
Hello, Mr. Brown. Can you guys hear me okay?
Oh, hey, Nikki, you're coming in broken, but we see you there. How about Lisa Alston? How about Dr. Dula?
Yes, good morning, Congressman. I am Dr. James Dula, retired Air Force, but 30 years in the Air Force, and I now serve as the Veteran Affairs Officer for Prince George's County, which also includes the Commission and our Women Veterans Advisory Group. We serve the largest number of veterans in the state of Maryland. It's a pleasure to be on this morning.
Thank you for joining us. And I know that you've been with us before on these roundtable discussions. Dennis New?
Good morning, Congressman. This is Denise.
Denise, sorry, Denise.
No worries, sir. I'm Deputy Director for Outreach for the Maryland Department of Veterans Affairs. We're the state agency here in Maryland that assists veterans, and thank you for giving us this opportunity.
And I enjoyed working with you every moment during the O'Malley Brown administration. Thanks for what you continue to do for our veterans.
Thank you.
John Church.
Good morning, Congressman. Good morning, everybody. Dr. Dula is a hard person to follow, but let me try. In this county, Anne Arundel County, we have the second highest number of veterans in the state. I'm the chairman of the Veterans Affairs Commission. And with you this morning are Adger Stokes, the vice chairman, Dan Tootle, former member of this commission. We're working hard to reach out to veterans in the county, and recently have established a dedicated telephone number for veterans to call if they seek assistance at the county level. So I can probably go into that later when we speak. Thank you very much.
Excellent. And are you also joined by Curtis Jones today?
I believe he intends to, but I have not seen him yet.
Okay, well, we'll certainly welcome him when he arrives, and welcome to Dan and Edgar. Thanks for joining us. If you want to say hello, please do so. All right, next, Andrew Fallon.
Mr. Congressman, good morning. Pleasure again to be here. I represent the Military Officers Association of America, the Maryland Council of Chapters, and as you know, we also provide some of the leadership for the military coalition. So it's a pleasure to be here, and looking forward to our discussions.
Great. We had a great meeting just recently.
Yep.
Deirdre Ware. Okay, what about King Smith? Okay, two VFW representatives. We'll say hello to them when they join us later. Is Alfred Smith with us this morning?
You do have one representative from the VFW from King Smith and Alfred Smith. I'm John Marshall, a member of the Executive Steering Committee that is sponsoring the Veterans Aquaculture Agricultural Training Center in PG at Lanham. Just want to let you know that we did receive a grant to start from the state to start the program. We're in the embryonic stage of it, and we just want to let you know we're operating in your vicinity, and that we're working in the area of food security and production, both with agriculture and hydroponics. We will build a facility at the VFW site in Lanham on Good Luck Road.
Excellent. Was that a federal a grant or a state grant?
That was a state grant. That was a state grant of $250,000, what we applied for and received just recently. And so we're now looking at support from Prince George's County to continue our effort. We have an executive steering committee, and it is an initiative of the VFW Post 8950.
Excellent. Well, welcome to the discussion. And Councilmember Stella Hargrove.
Yes, I'm here. How are you? I want to say hello to everyone. I serve on a few committees. I'm the council member from Fairmont Heights, right here in Prince George's County. I also work with Dr. Dula on the Women's Veterans Advisory Committee, and NADVAT with Michael Riddicks and the Women Warriors. So I serve in a couple of positions supporting the veterans. Thank you.
Thank you, and thank you for joining us. Michael Riddick.
Morning, Congressman. I'm a proud 21-year retired Army vet. Presently, I'm a commissioner for Prince George's County Veterans Commission and regional commander for NAB Vets. And we're continuing the mission to support our veterans here in Prince George's County through claims assistance. Throughout the pandemic, we didn't even slow down, so we kept it going, and our veterans are much more appreciative of that. Thank you.
Excellent. Well, thanks for continue to drive on even during this pandemic, as I know so many of you have. Let's see. I'm exhausted my list, but I see Kevin Cohn. Have you introduced yourself?
Good morning. I'm Kevin Cohn. I work at the Department of Veterans Affairs in the Office of Management, the CFO in the Office of Financial Policy, basically responsible for grants policy for the department. I am a proud native of Maryland and Army veteran, and I really appreciate the opportunity to speak with you today.
Yes, indeed. And I appreciate you being here, and I look forward to your participation in this conversation. Paul Jones, have you introduced yourself?
No, sir. Good morning, sir, and thank you for allowing us to be part of your roundtable. I'm Paul Jones. I'm with the Department of Veterans Affairs at the Baltimore Regional Office. On behalf of my director, Mr. Antoine Waller, and my assistant director, Ms. Lisa Green, we thank you for this opportunity to be part of this.
Well, thank you for joining. And did I miss anybody? If I miss anybody, just sort of unmute yourself and introduce yourself, and then we will proceed to our presentation from the VA.
Good morning, Congressman. I am Angela McCullough, a proud 21-year Air Force veteran. I serve two hats in this capacity today, and one is, how can you not work with Dr. Dula? I mean, really, I agree with Andrew. It's hard to follow this man, but it's hard to keep up, honestly. But I am also one of the members on his team working with Prince George's County. And the other part of that with Dr. Dula, we also focus on women's businesses in Prince George's County. So I work in that capacity as one of the incubators of starting up a women veterans federal contracting office. And we have that over at the Iverson Mall in Prince George's County. So again, Congressman, thank you for the opportunity to be on this call. Nichelle, always thank you as well for the invitation. Everyone have a wonderful day.
Thanks for joining us. I think that's it for the intros. Did I miss anybody? All right. So Adam, who are we going to turn it over to next?
Turn it over to Mr. Kevin Cohn, who has a brief presentation. Mr. Cohn.
Go ahead. Share my screen. Yes. I apologize. Can people see my screen? Not yet.
Yeah, no, we can. I can see it. I'm assuming everybody else can. Yep, I'm seeing thumbs up all the way around.
I just wanted to briefly spend just a couple minutes to talk about the grant programs that the Department of Veterans Affairs currently has and what will be coming online here in the next 12 to 18 months. Currently, VA's annual budget for grants is just north of $2 billion. With CARES Act funding from last year and from this year, it went a little bit above $3 billion, but it will reset itself to about $2.5 billion going to next year. We currently have 9 active grant programs at the Department of Veterans Affairs, but we do expect 4 and possibly 6 new grant programs coming online, and I'll touch on those here in a minute. We basically break up our grants into 3 categories. We have our competitor discretionary that primarily go to nonprofits to provide services to veterans. We have 2 construction programs, both the state home construction and the National Cemeteries construction. And then we have 2 per diem programs that I will touch on a little bit. And then the way our grant programs are administered at VA, each office basically runs the entire life cycle of the grant programs in their particular office spread out across the country. This is just kind of a listing of our active grant programs and their current FY21 funding. As I mentioned, we have the state home construction program, which provides funding for 2 states to build, maintain, upgrade state-run facilities, where the VA puts up 65% and the states match that with 35%. We have the VA Adaptive Sports Program for active duty military or veterans with disabilities, providing across the country different kinds of sports and activities, hopefully helping with rehabilitation and other paths moving forward. We have one of our 2 homeless programs, the Homeless Grants and Per Diem program, which provides services to homeless veterans or veterans at risk of becoming homeless that are in shelters across the country. We have about 600 shelters that we are supporting. State Home Per Diem, that is where we actually pay daily per diem rates for veterans that are housed in those state-run veterans homes. And it's based on a level of, service-connected disability type of care, et cetera. We have our other homeless program, which is the VA Supportive Services for Veterans and Families. That provides a multitude of services, again, to veterans that are homeless or are at risk of becoming homeless or their families. It can provide things from paying to have a vehicle fixed, transportation to job interviews, clothes. It can pay rent if you're at risk of becoming homeless. There's a number of services that is providing. We have the Veterans Cemetery Grants Program, which provides for either the construction, upkeep, or maintenance to state, local, or tribal cemeteries across the country. We have the Veterans Transportation Program, which provides transportation to veterans that are in designated highly rural counties across the U.S. determined by the Census Bureau. And then we have the Especially Adaptive Housing Research Technology Grant. One of our benefits programs that the VA provides, and VBA may speak to it, is adaptive housing grants for disabled veterans. This is a research in new technologies towards adaptive housing that we hopefully will consider. And then the final active grant we have is for the retention of nurses or the hiring of nurses at those state-run veterans home. And then to briefly look, and the Congressman had actually touched on this, one of our new programs that we're really excited to get online as soon as we can is the Staff Start Fox Suicide Prevention Program. And again, this is something that we're actively working really hard to get online as soon as possible, but it's to coordinate suicide prevention services for veterans and their families across the country. We also have the VA Atlas Telehealth Program. This is, again, is keyed towards rural areas to provide at least consultation to veterans or their families that can't get to VA facilities. I mean, the best example would be a pod set up in a Walmart, which is secure. They could go in and meet with a doctor or nurse through, video teleconferencing and take vitals and get it, at least initial consultation. We have a new homeless program coming on board to provide legal services, again, to homeless veterans or veterans at risk to become services. The supportive services for veterans and families that I'd mentioned before does provide some limited legal service. This just greatly expands on that and provide a long list of type of legal services that we can provide at government costs to homeless veterans. And then the final is the National Cemeteries Legacy Grant Program. And this is to work with local communities around either state, local, or tribal cemeteries to basically produce educational materials and honor those veterans that are interned in those facilities and make sure that their legacy lives on and tell their story. And finally, I just wanted, for the group and anybody online, I wanted to leave my contact information. If you ever go on grants.gov, I'm listed as the point of contact, so you may already have it, but here's my contact information. Again, I work in the Office of Management, so I may not always have the answer, but I will work the best I can to find the answer for you or put you in touch with the right person at the Department of Veterans Affairs. But I really appreciate your time and thank you.
Well, thank you, Kevin. Adam, are we opening it up to a conversation now?
Actually, sir, we have one more presentation from Mr.
Oh,
Paul.
great. Okay.
Mr. Paul Jones, please go ahead.
Yes. Thank you again, sir, for allowing us to be part of this. VBA has put in 3 new presumptive issues on the Agent Orange registry. That's bladder cancer, hypothyroidism, and Parkinson's have been added to the Agent Orange registry. Also, here at the Baltimore Regional Office, we're one of 3 test sites for a new visitors engagement program where veterans and service members and everybody can make their own appointments. They can come on our site, get it off of the va.gov site up under the Baltimore Regional Office, and put in for an appointment, schedule their own appointment, the day, the time. If that time is still open, they can apply for that appointment and put it in. And they'll be getting a call from us, or they can do it in person. We have that option now. We're setting that up through appointment only. And they can get that, again, through the va.gov website up under the Baltimore Regional Office homepage, or they can, we also have it, the VA hospitals and a lot of the VSOs should have this flyer out now where they can get the URL, the QR code, where veterans now can take their phone and just plug it up like they do at the restaurants to get the menus. They can just do that and get that code, and it'll take them right to that appointment schedule to schedule their appointments with us. And again, most of our appointments are via phone call due to the pandemic, and for everybody's safety, the veterans and ours, we're setting that up to where we can do that. Like I said, right now, we're one of the 3 test sites for this program, which should be incorporated probably by middle of this summer, probably by July time, from middle of July. It should be coming out nationwide. So I just wanted to like that. And also, we here at the Baltimore Regional Office and my department here at the Baltimore Regional Office, I would like to put our name out there to assist people. We do a lot of claims clinics where we come out and assist and set up and speak with veterans and help them with their claims at these functions that VSOs or anybody have. We have one scheduled, I think, at the VFW in right outside of Andrews Air Force Base next month. In I want to say it's July the 17th. It's that Saturday. I want to say it's the 2nd or 3rd Saturday of the month of July. They have it at the VFW in right outside of Andrews Air Force Base. I think that's Suitland. I think that's the Suitland area right there in PG County. We
Right, that's
participated with them. We participated with that area. This is our 3rd or 4th year now being part of that. So I just want to make sure anybody that needs our information or help, by all means, reach out to us, and we'll be glad to assist you with a claims clinic. I'll bring my people out and we'll sit down and we'll go over veterans' claims, talk to them about their claims, let them know what's going on with them, help them apply for their benefits. And also the most important thing that we do is we provide the veterans with information on what they need to do and how they need to do to file their claim and what all actions they need to do to put their stuff into work to get a better results from us. And again, thank you, sir, for this opportunity.
Well, thank you again for providing that information. Let me open up the discussion with a question to our VSOs, the commissions, and associations represented, and certainly now that we have representatives from the VA, both state and federal, it may be a good way to open up the conversation. But what have we seen during the pandemic as some of the biggest challenges in terms of helping veterans access resources? Anybody want to offer some observations or thoughts on that?
Congressman, this is John Church. I'd like to lead off. Can you hear me?
We can hear you.
Okay. Unfortunately, Gunny Jones is not here, but I want to echo what he has told me during the COVID pandemic. Many veterans approach Gunny with problems that they cannot solve without his help. Building problems with housing, problems of mold, which makes the house uninhabitable, problems with the need for wheelchair access ramps and decking around one's home that is falling apart. And the veterans involved don't know where to turn. And so but they do know him and they come to him and he in turn reaches out. So my point is there are many people seeking help. They don't know where to go because sometimes the system is too complicated. to decipher or find your way easily. And within this county, we do not have a Veterans Affairs Office. We have this commission, which is trying to understand the needs of veterans and subsequently to address those to the county executive. It's not easy. I'll leave it there. Thank you.
Quality of housing related issues. Is that what I'm hearing?
That's a good part of it. Yes.
Does anybody from state or federal level want to kind of speak to that issue and offer some suggestions or guidance? We'll take that one for the record. Let me open it up to our organizations, associations, and to raise issues that you're seeing that you need addressed that we can talk about this morning. Anybody want to start?
Yes, this is Councilmember Stella Hargrove, and as I said before, I work with a couple of. I'm a veteran also, 8 years. I work with Dr. Duler and with NASVAC, and some of the things that I see from our women veterans is the need, their homelessness, and they are the ones that come home or leaving the military. It's a transition for them, and sometimes they find themselves homeless. They have their children, and I did hear about the grant for homelessness. I think we need to focus more on the female veteran. I'm not taking anything from the men, but a lot of times the female veteran is the one who has the children along with that. So again, that would be the homelessness, the transition from military life to civilian life. And then a lot of our veterans female veterans suffer from MST, military sexual trauma. And then the second part of that is when they are home, they may fall into another abusive relationship and not have anywhere to turn to. And that again leads to suicide prevention. So those are some of the things that we need to kind of home in on and let our female veterans know there's help here and where they can go to get that through the Office of Veterans Affairs, through VA and Dr. Dooley. We've been working with that, and also through NASVAC. Women's Warrior Program. So these are the things that we focus on, but we also need help from you guys, Congressman Anthony Brown, to look into that and maybe a bill or something where we have focus on the female veterans. And then the last thing I want to say is that I find that when we come home and a lot of our female veterans may be missing limbs, I'm not saying you particular, but the VA tries to modify what they do for the men for the women. We need to have a particular area that when they modify those limbs, they're modifying those limbs for women and not trying to take what we have for men and make it fit for the woman. And that's all I have to say. Those are the things that Dr. Duler and Michael Riddick that we have been focusing on as part of the communities that I'm a part of. Thank you.
Well, thanks, Councilwoman. I see that Kevin Cohn has put in the chat a website to access information about what is happening at the VA to support women veterans. Kevin, would you like to maybe elaborate on or address at least some of the points that were raised and what kind of information we could find at that link?
Yeah, I actually, it's just by circumstance when I was in DC, their office was right next to our office. And I have actually a few friends in that office. I don't really want to speak on behalf of them, but I can certainly put you in touch with a really good friend of mine that is in that office. It's a small office, but they do report directly to the secretary. So they hold a heavy clout. But I can certainly pass that information and that point of contact to you, Ms. Hargrove, if you would like.
Congressman, this is Dr. Dooley, if I may, sir.
Yeah, doctor, please.
Yes. In Prince George's County, we have set up a partnership with our community. We have been able to have nonprofits come online, and they have been providing the bulk of housing for our men and women veterans who are in need of housing, but it comes at a cost. You know, they have to charge for the rent. Normally it's somewhere between $500 and $900. I said that to say this. We've been very fortunate to do that with our nonprofit community to find the housing, but at the same time, the funding is lacking. If there's any grant programs, for example, to open up or to contribute to the nonprofit homes that we have opened up with our partners, we would certainly like to know about it. I know that we're looking to open up one in June, later on in June, but the subsistence funding for that is the hard part. Okay. And it's not $100,000. Normally it's somewhere in the range between $1,000 and $10,000 needed to refurbish or to modify the homes. But the partnerships we have created has been a big help. But if we knew where the grant funding was so that it could help those that operate the facilities, it would be very helpful.
Kevin, do any of those grant programs that you listed and discussed match up with the need that Dr. Dula identified?
The grants and per diem program in the homeless office does have a capital grant aspect to it. I would have to put you in touch with them about the availability. We also, if you want to reach out to me directly, there are, and we've kind of done our research, it's VA is not the only people providing veteran-centered grant programs. There are from Department of Labor to HUD. There are a lot of VA-centered grant programs across the federal government that we try to tap into and make that information available. But I can certainly check on it if you would like to contact me directly. And I think I provided my email. It's just kevin.cone@VA, cone, C-O-N-E, like ice cream cone, at va.gov. And I can do my best to put you in touch with the right people and do the little research on it.
Thank you.
And
The
Mr. Brown?
issues. Yeah, go ahead.
It's Mike Heimel, the director of the Washington DC VA Medical Center. And I do want to highlight that through our homeless outreach program, we have vouchers from Housing and Urban Development in a partnership with the VA that help assist with things like rent to get homeless veterans off the street and into stable housing. Majority of those are used in the district, but we do have vouchers available for the Maryland counties as well as the Northern Virginia counties that we have responsibility for. There's a lot of things that factor into how many vouchers are available per jurisdiction. Probably one of the most important things is the annual point in time counts that are done every January of homeless populations that helps us identify how many vouchers we need and how to distribute those. So that is one area where I would love to have a conversation with the community leaders who have been supporting these veterans. The other piece is through our prosthetics department, we do offer home modifications for things like wheelchair accessibility or other mobility challenges. The amount of money that we're able to spend on those are a little bit more limited. But we may be able to do some outreach with some of the other programs that Mr. Cohn had discussed.
One of the things that we are aware of, we're aware of those programs you speak of, but we have not found a program yet that provides assistance to the veteran that would just like to occupy a room. They're normally for apartments or more permanent housing. So that may be something that we need to think about as I work with the nonprofits that have the facilities to offer rooms in the housings to men and women veterans. They can't get the vouchers you speak of, so it might be something we want to take a look at.
Is there flexibility in the program, or is that something that Congress needs to look at to incorporate greater flexibility?
Yeah, and actually, sir, I think there's another avenue to discuss with Dr. Dula and some of these groups is we have grant and per diem facilities where we reimburse facilities on a per diem basis for veterans that we are moving out of shelters, getting them into a more stable environment before we can put them in a home or an apartment on their own. Right now, those are only grant per diem facilities are inside the District of Columbia. We currently have contracts with 3 of them. Certainly, those groups that you talk of can apply for those grant and per diem programs. And I do think there's a need in the county surrounding the district for more of this. So certainly our social work service is more than happy to work with you on it.
Right, and I'm going to make sure that my staff is available to you, Dr. Dula, to see if we can't access that and bring those resources and that opportunity out to outside of the District of Columbia into Prince George's, Montgomery, and elsewhere. On another housing related issue, and we've been getting calls in my office about, and maybe someone from the VA can speak to this, is the COVID-19 housing allowance for college students receiving, whether it's the new GI Bill benefits and getting a housing allowance, but then all of a sudden their program went to virtual online, and in many cases, universities and colleges sent the students home. And there have been a lot of questions about whether or not that housing allowance is still available. Is there anybody able to speak to that issue?
Yes, sir.
If I'm not
This is John
mistaken.
Church.
Oh, go ahead, sir.
By coincidence, I spoke yesterday with a gentleman in Baltimore on this very point, and I was assured that the legislation that exists extends housing allowance benefits in most cases to veterans through 21 December of this year. And that there are some fine details that I don't recall, but nevertheless, the big message is just what I've said. Thank you.
Mr. Jones, were you going to weigh in on that?
Yes. Also, sir, I think that they still get the housing, but it's at a reduced cost. It's not at the full range that they would normally be getting that. So it's reduced to a virtual environment cost. So they wouldn't be getting the full amount that they would normally be getting if they were in class.
Thanks. I appreciate that. And another question that we get, an issue that's raised with our office regularly, is what facilities or resources are available to veterans for the COVID-19 vaccination, and what's the best way to reach out to the VA to get on a list or line for that?
Mr. Brown, let me take that one from the medical center. We have been offering vaccinations for veterans since about mid-January here at the medical center. We've also done a couple large events, one in Charlotte Hall. Actually, we've done 2 events in Charlotte Hall in the new community-based outpatient clinic there. We've done one in Montgomery County as well as one in Fort Belvoir. The challenge with doing one at our Prince George's community-based outpatient clinic is the space that's available for us to do one there. We have about 25,000 veterans now about 52,000 that rely on us for care who are fully vaccinated. Actually, the number this morning is 24,208. And we continue to offer vaccinations here at the medical center Tuesday through Friday. We have scheduled appointments for the Pfizer vaccine from 8 a.m. to 2 p.m. But we'll also take walk-ins at any time. In fact, yesterday was a day we weren't running a dedicated vaccine clinic, but we had 20 veterans walk in requesting vaccinations, and we provided them. Really, since about the end of April, the numbers are down dramatically. And I know there are a number of veterans who've received vaccinations in the community, and they are reporting that to us as we do outreach. Right now, we've got about 5,200 across the community that we know have received a vaccination across the district that we're responsible for. So there are vaccinations available. I would love to be able to gauge the interest of doing an event in Prince George's County. In particular, we're doing a homeless event with the District of Columbia downtown today. And we did an event at Rolling to Remember on Sunday in partnership with AMVETS. But as we have done outreach to veterans now to see what the demand is to bring something like the Johnson & Johnson vaccine out into the community, we've had very, very little interest in that. And so would love to be able to partner with the VSOs and see if we could get 100, 200, 1,000 veterans from the community in and do an event in Prince George's County.
Can I ask you a question, sir? What are you getting? I'm a veteran and I didn't get my shots from the VA. I got them from Walter Reed. So the count that you have for veterans receiving their vaccinations is not inclusive of those veterans that are getting it at Walter Reed Army Medical Center or the military facilities. Is there a way of collecting that data to make sure that you have a total number of the veterans being counted?
Yeah, we've sent mailings out to all the veterans that are enrolled to this facility, asking us to report if they've received a vaccine from someplace other than the VA. There's nothing in the database that reports to CDC that identifies you as a veteran.
Yeah.
It does identify your residence. So the state of Maryland can pull from DOD and say and note that you were vaccinated, but I can't necessarily pull that way. The other thing that we have been recommending, and I'm a veteran myself, I received my vaccine here at the medical center. I took a copy of my vaccination card to my PAC team here at the medical center, and they scanned that into my medical record because, of course, as an employee, my documentation was in our occupational health system. And so we're asking as we schedule appointments, if you've been vaccinated and you have it, or you have an interest in being vaccinated. If you have, we're asking you to bring your vaccination card with you so we can get a copy and we can put that into your medical record so that we have all of that documented. And some of this can be important because, you know, there's a great study going on right now that looks at mixing and matching vaccines for a booster shot. The National Institutes of Health is actually doing that study now and enrolling people in it. But when it comes time to, if it becomes time to do a booster shot, we may need to know which vaccine you were vaccinated with the first time if the NIH study would come out and say we shouldn't mix and match vaccines, for example. But hopefully that won't be an issue and we'll be able to mix and match. So, you know, anxious to see what that data says. But I think that's the most important message for veterans. Get the vaccine any place that you can get it. It works, it saves lives. Our hospitalizations, we have not had a patient, we've had 7 admissions during the month of May. And we went a stretch of 8 days with no inpatients with COVID in our facility. And that's proof that vaccinations work. If you do get COVID when you're vaccinated, the symptoms are much more milder, and the demands that will be placed on the healthcare system aren't anywhere near what we experienced last April and what we experienced in December and January.
Congressman Brown?
Dr. Doolittle, let me go to Stella first, and then we'll come back to you.
Yes, you were looking for a location in Prince George's County. I think the Sports and Learning Center would be a great location. They can host a lot of people. That's where I voted, and I think that's a good location to check to see if we can have our veterans come there. I believe there's enough space.
And they've done some vaccination operations at the Sports and Learning Complex in the past. I don't know if that's regularly scheduled and still ongoing, but that certainly is a great location. It's proven to be successful in the past. Thanks for raising that up, Councilwoman Hargrove. Dr. Dula.
Yes, I just wanted to reemphasize the fact that in Prince George's County, we have an Office of Veteran Affairs. And anyone that would like to do business in that way with Prince George's County, if you will contact me, then we will coordinate with all the VSOs and the community-based veterans organizations to make sure that they are aware, as well as I report to the county executive. She will also be aware of the initiative, and I'm sure she will support that. So we'll be glad to work with you. Sir, if I may raise another point, I know time is getting short. But the Vietnam veterans who served in Thailand asked me to mention Senate Bill 657 that addresses Agent Orange and chemicals used in Thailand. I know that the Congress has passed approval to recognize Thailand in the past for Agent Orange, but it's quite limited. Veterans that served there were sprayed every day. around with chemicals and came back home with the same illnesses that that veterans in Vietnam proper are experiencing. Many have died. I talk to the spouses every day. Their husbands died from the same symptoms. I have some of those symptoms as well from being there in Tak Lee, Thailand with linebacker 1 and linebacker 2, where we were sprayed with chemicals around us, around the dorm areas and the whole 9 yards. And we all came back with the same symptoms. But when we apply to VA for disability, well, we're routinely denied. And I think that is something that needs to be addressed because too many veterans are coming to my office saying I have the same symptoms, but I'm being denied by VA just like I was recently denied for the 3rd time. So I think that is something that if we can look at that, it'd be appreciated.
Oh, thank you for raising that, Dr. Dula. And as I mentioned earlier, Chairman Takano laid out priorities for the 117th Congress for the House. And among the 9, the top priority that he's identified is addressing toxic exposure. And there are, many bills covering different periods, different toxic substances. So what he's proposing is putting those together in a comprehensive package, and it would include the provisions of what you referred to as Senate 657. I'm a co-sponsor of that bill. We've had some hearings on that already, and I'm pretty confident that we'll be able to get the level of bipartisan support we need to make some real progress in addressing these outstanding, continuing issues around toxic exposure. So we'll keep you informed of what's happening on Capitol Hill.
Thank you, sir.
Mr. Heimel, can anyone speak to the status of or discussions around the plans for a CBOC in the vicinity of Joint Base Andrews? I understand that there's an effort to do some consolidation.
Yes, sir. Actually, we have a current CBOC right across the street from Malcolm Grow, separated by the road and the fence. There is in the president's budget a lease proposal for a new community-based outpatient clinic, much larger facility to support Prince George's County and veterans in the county in the 2022 budget. So we expect that that's not going to be an issue, and as long as the budget's approved in 2022, we'll be picking a site and looking for a partner to do construction with.
So it's my understanding from what I'm hearing from you is that generally in the same vicinity, but looking to expand the capacity, the size of the facility.
It may not be in the same general facility, but we do know that there's a definite need for one there in Prince George's County. There's a lot of options in terms of medical construction, as you know, that are going on right now around the Beltway. And so it's one of the things that we'll be working with the contracting office in the next couple of months is a firm site selection. And my goal is as soon as the money's appropriated and we get a green light to proceed from the department, we'll select the site and get that facility moving. It's long overdue.
Yeah, we've been hearing a lot about that as well. Let me open it up again to anyone else who wants to raise an issue.
Yes, Congressman Brown, this is Mike Riddick. A couple of issues, one for the VBA side of VA and as well as the VHA side of VA. The first one is for VBA side. I'm getting a lot of calls and a lot of feedback from veterans that are complaining about the appeals. We know that there's still a backlog, but there's questions about have they hired additional staff, as far as in one term they mentioned lawyers to handle the appeals for the veterans. And it doesn't seem like anything has sped up, coming out the pandemic, things are opening back up and veterans are calling and they're trying to get service. So, and the second issue is on the VA side, I have a number of veterans that have called me within the last few weeks trying to get scheduled for hearing appointments. They indicated that their appointments, they can't make an appointment and they have to call back a month later to see if they can get scheduled for an appointment. So I don't quite know what's going on with that area there, but it's causing some confusion in the veterans community as far as trying to get service for audiology appointments.
Sir, can I piggyback on him and about the appeals? I'm hearing a lot from the veterans in the area, particularly among females, because the people that are doing the appeals for females don't understand what it is that females go through for the female, and they are arbitrarily putting it on the back burner. So I think that they need to really put some emphasis on female appeals. The people are getting it, but they're getting the minimum disability opposed to what the max is because of the time constraints. And I think it goes back to what the councilman said earlier, that there has to be some emphasis placed not only on the female veterans in order to do that, and that would reduce some of the homelessness in some extent, because they're spending a lot of money, with medical and trying to get appeals. So if there's something can be done with that, I agree with you, sir.
Would anyone like to take up the appeals issue as well as the appointment time for audio?
Sir, I'll take the audiology question, and Paul, I'll leave the appeals issue to my friends at VBA. We are still operating under restricted capacity based on COVID-19, and we have begun gradually reopening. We have a 3-tier reopening plan that is based on the prevalence of COVID infections in the community, as well as vaccination rates in the community, and then our ability to maintain social distancing requirements within the facility and our waiting rooms in particular. We're currently in tier 2 of that plan, and we're anxiously waiting. The only thing that's really preventing us from moving to tier 1 are vaccination rates in the community. It's great. Maryland's got close to 70% with 1 dose on board. We want to see those second doses on board, and we need to see the District of Columbia catch up to that number as we go forward. But under our tiered process, 6 feet of social distancing is still required, which restricts the number of people we can have in a waiting room at any given time. On Tuesdays, we look at reopening plans for each of our clinical services. Audiology submitted their plan yesterday. We will review it Tuesday morning, and I expect that we'll approve their reopening plan, and you'll see some more audiology appointments become available. And then as soon as we can get the entire DMV, or at least the Northern Virginia part of the DMV to that 70% mark, we'll be able to reopen almost to full capacity. We do have a number of services that are in high demand, like dental and gastroenterology, where we are operating at close to 90% capacity. And our operating rooms are fully operating. So one of the things we've done very well during the pandemic is not delayed surgeries for veterans who needed them. But I'm confident if we can hit the president's targets by July 4th of 70% being vaccinated, we'll be able to get fully reopened.
Paul, did you want to take that appeals issue?
Yes, sir. Yes, they, as we all know, they've centralized a lot of the appeals at Florida, Washington, and in DC, the district. They are in the process of hiring people. But again, you still got to understand that during the pandemic, a lot of things went into the backlog because a lot of people wasn't able to. Plus, that includes the hearings. We're getting ready to open back up for hearings here in probably within the next month or so, for hearings, in-person hearings that was scheduled. So they should be getting hearings, receiving information via mail saying that they appointment scheduled for a hearing if they requested a hearing, then, and they will be able to come to the office and that hearing will be conducted via the virtual hearings. But again, yes, they're trying to catch up. We're trying to catch up as fast as we can with the appeals. We know that there is a backlog of it, but we're getting them completed as soon and as quick as possible.
Well, thank you for that. Hey, listen, we're at our 11 o'clock hour, and I did commit to each of you that I would hold you no longer than an hour. It's the only way I can be assured that you'll come back at the next invitation. But I do hope for those who have tuned in and zoomed in that this has been an informative session as we've raised a number of issues, a variety of issues impacting and important to veterans. I want to thank those at the United States Department of Veterans Affairs for what you do at our state level and certainly on our county commissions and at the VSOs. Veterans continue to serve veterans and returning that debt as best we can to the service of men and women in uniform. So thank you once again for joining us. I certainly hope that you have a wonderful summer. Stay safe. And as we are sort of slowly progressing to the new normal, know that my office is available either on Capitol Hill or in the community. So feel free, please, to reach out to me if I can be of any assistance. And with that, let me just say thanks and have a great day.
Thank you, sir.
Thank
All
you,
righty.
sir, and thank you to our panelists for joining us today. If you need assistance with the Department of Veterans Affairs or other federal agencies, please reach out to our office at 301-458-2600 or md04.info@mail.house.gov. Thank you so much for joining us today, everyone. Have a safe and healthy day.